Hello and welcome to our webinar today. This is a joint webinar between the Indiana Association of United Ways and IU Health, or Indiana University Health, to discuss our wonderful joint project called Kindergarten Countdown Camps. And what we'd like to do, I will first introduce Stephanie Berry with IU Health. And unfortunately, Heather Gurton, who is with United Way of Central Indiana, is ill. She says that she'll be listening in and watching, but she may not be able to join us as a participant today, leading this call. So our goal is to give you a quick overview of this wonderful partnership, talk a little bit about what happened last year, and then talk through the goals for next year. But I will turn it over to Stephanie Berry, who can talk a little bit about who's on the call.
Great. Thanks so much, Lucinda. Really appreciate that. For those of you who may not know me, my name is Stephanie Berry, and I am Manager of System Coordination for IU Health, which means I get to work with the 18 hospitals across the state that are affiliated with IU Health. And I do want to take the opportunity to say thank you to everyone who's been a participant and really a driver of making Kindergarten Countdown the success that it has been over the last few years. It is absolutely the signature project for Strength That Cares, and one of our favorites, not only because it's such a wonderful program and so fun to deliver with kindergartners, but also because we have metrics and outcomes associated with it, which can be really hard work to do, and this has just been a beautiful partnership and being able to impact those kids, make a difference in the lives of those. So I just want to say thank you so much to everyone who's helped do that, and we look forward to doing it even better in 2014. On the call, I just wanted to make sure that everybody gets a chance to meet each other and know who you're going to be working with in case we have a handful of new people. So in Delaware County for IU Health Ball Memorial, we have Sandra Hoover and John Disher. Sandra will be the main point person there. And then in Hamilton County, we have Andrea, who works at IU Health North, that will be doing this generally in the Sheridan area. And then we have Kathy Stoll for Hendricks County, who will be the main point of contact for IU Health West. Up in northern Indiana, we have Laura Gould, who has been handling a number of camps up in the LaPorte area. New to IU Health this year is Rachel Lott, and I hope Rachel's able to join us from Lawrence or down in Bedford. Been a fantastic partner. She's new to IU Health, but she's going to be a strong champion for this project, I'm quite certain. And then someone who's not new to IU Health, and I think actually Connie had a conflict today, so I believe Gina is on the call today for Connie, but she's out of IU Health Bloomington. And then Laura Gold does double duty and also oversees IU Health Stark. And then down in Tippecanoe is Kier Kreitz, who's relatively new with IU Health, but also a wonderfully new, strong partner. And also, Kier will be also covering IU Health White Memorial as the contact there. And then in Tipton, Indiana, last but not least, is Chrissy Profit, who has been working in this venue for a number of years, and so probably a familiar name and face. But those who, the main contacts will be from IU Health. And Lucinda, I don't know if you want to do any introductions on your end for any of the counties.
I will let you just read the names here. From an Indiana Association of United Ways perspective, I just want to share with everyone that our membership includes both United Ways and United Funds, and we are very fortunate that counties like Stark and Tipton have United Funds, and the United Fund, for example, in Stark County and in Tipton County are both run through the Community Foundation, so we are very appreciative of their partners. So United Way will, or the United Fund will play a lead role, and in some communities that lead role is actually managing every single aspect and staffing it. In other communities like Stark County, we are so grateful to have Peggy Scheidecker at Knox Community School Corporation to work with us because Peggy is actually the curriculum director. So I just want to offer that from a United Way perspective, we work very closely with the schools, and sometimes in some communities the school is the lead, and in other communities with United Way's help, and in other communities the United Way or the United Fund is the lead, where the schools are the partners. So it just varies by United Way. So we invite you to get to know each other if you have not already done that. So Stephanie?
Yes, thank you. As Lucinda shared, really just want to do a really brief overview of what is Kindergarten Countdown, particularly for any of our newer members, and kind of why we do it, why we think it's important. And then we'll do a brief recap and debrief of what worked well in 2013 and what were our successes. And then what do we want to do a little bit differently? What can we improve or tweak in 2014? So that'll be our agenda for today. This is just a favorite picture of mine. I just love the fun, just the sincere fun that both this kindergartner is having and also the volunteer. And I just feel like this picture really sums up Kindergarten Countdown. It's just, honestly, when I volunteered, it's just one of the best experiences I've ever had as a volunteer. It's one of those things that will absolutely warm your heart to get to do. And then what's fantastic is when you understand the need for Kindergarten Countdown, just the impact that you're going to make. And I do want to share, when Kindergarten Countdown was designed about 3-4 years ago, it really was designed to be the signature project for IU Health employee volunteer program, Strengths That Cares. And so it's really one of those things that want to make sure that as IU Health, we are doing all that we can to put the resources behind the program and really truly make sure that we can make that connection for our volunteers to the mission of IU Health and in improving the lives of these kindergartners.
And just to add on to that, in terms of the history of this project, it grew out of a United Way of Central Indiana initiative called Kindergarten Countdown that had sort of a three-pronged approach that really addressed the needs specific to Indianapolis in terms of being there on the first day. They had a real issue with kindergarten attendance on the first day, parents actually knowing that when school starts. And then the kindergarten readiness and actually running the camp and providing them that camp experience. As we've expanded it around the state, we identified that be there on the first day is not necessarily an issue in many of your communities around the state, but the readiness piece and the provision of a camp that provides experience to those kids who've never had a formal care setting or never been in a school is very valuable. So Stephanie?
Thank you so much. This is one of the slides that I have borrowed from Heather, who was unable to join us today. But I think this slide says so much about why we're doing what we're doing. And I was really, honestly, before I got into this area, was shocked to learn that only about half of the kids entering kindergarten are prepared. And what I thought was even more shocking is that those who are not caught up by 3rd grade typically never get caught up. And I think that's pretty staggering, and also really stresses why this is so important to make sure that kids are ready, and that if they're not ready, we get them caught up as quickly as we can so that they can be successful. Because we know through research and different studies that if you have a higher education attainment, it really impacts the kind of job you're going to have and whether you're going to have insurance and all of those other things. So it really impacts your health at the end of the day. And I think the graphic at the bottom of the slide that shows that kids from middle-class families are read to, on average, about 1,000 hours before they enter kindergarten. But unfortunately, kids from low-income families often are only read to 25 hours before they enter kindergarten. And that's really the goal of making sure that this program helps make up that disadvantage for those low-income families.
Oops, I think I skipped a slide there. I think I'm missing a slide. I apologize. There's a slide missing here that's in your slides that talks about public education. I apologize. So if you don't mind, that's, I think, in your printed slides, but not in this particular slideshow.
Yes, and I know exactly what slide that is, and I think I talked just a little bit about, the effect of, literacy in our rural communities and also in IPS. And so it's really just an impact across the state and how important it is. Then, Lucinda, you might, I don't know if you want to take this
Yep.
one or not. I know this came from the report that you put together that just shows where we're doing kindergarten countdown camps.
Right. As I mentioned earlier, we were very fortunate that United Way of Central Indiana took the lead here. And then the map at the right reflects 2013 as the grant through Indiana Association of United Ways. So it does not include Hamilton and Hendricks County on this map. But we started this idea of expanding into the IU Health footprint, and in 2011 expanded it to 8 counties and several camps, and then 2012 expanded it to 13 camps in 10 counties, and then last year there was such an interest by other United Way partners and by other community partners and school partners that we were able to leverage the IU Health grant with other dollars in local communities to offer 11 counties, 24 camps. And you can see those on this map. The blue represents those sort of inspired camps that are not in IU Health regions, and then the red in the IU Health. And we'll get to the actual numbers a little bit later. The camp design is really important as providing the integrity of this model. It is a 4-week camp, usually half day. In some of the communities, they run it as a 6-week camp. We really feel strongly that it needs to be in a school. We've had some community organizations approach us about having it, say, at a YMCA or at a different Boys and Girls Club or a different kind of facility. And it's part of the camp design is to introduce these youngsters to the school setting. So we really stress that it has to be in a school, it has to be led by a qualified teacher, and where there's a lot of need, it's really important to have an assistant. We try to have the IU Health volunteers each day and other community volunteers, and we'll talk about one of those great successes, for example, up in Tippecanoe County, where they had wonderful partnerships with the faith community and other community organizations to provide lots of volunteers in each of the schools. We do require that the curriculum be approved, that it is a formal curriculum, and again, more of a formal kind of camp rather than just a recreational camp that might be offered in the summer. As a part of this project that was funded by IU Health, we require pre- and post tests for every student. And we know that there are lots of good assessments out there like DIBELS and Brigance, but for ease of use with volunteers and non-credentialed staff, we use what's called the Get Ready to Read assessment, which is a pre-literacy assessment, and it's available through Pearson. So for the curriculum, we have provided Cozy Corner, but we have also approved other curriculum that, for example, a school may already have incorporated into their plan. There are some design options that really meet the needs of a local community and the local school. So in some communities, transportation is a high need and the camp would not be a success without transportation. In other communities, transportation is not as much of a need. So it really varies by the school and by the community. In many of the camps, we actually build the camp onto an existing summer school program, so there might be meals already provided, there might be transportation already provided, or not. The camp design options also include some other things that are provided to the students. For example, backpacks and materials for the parents. In some cases, there's been a school supply drive for the students so that they can prepare better for the beginning of the school year. In a couple communities, they have been able to recruit partners in the community to help with field trips, though just to recognize that those costs are not provided by the IU Health grant. And we also wanted to highlight that we have a number of other organizations, United Ways around the state, that are supporting similar kinds of models like one is called Begindergarten in Cass County, and that's a very similar kind of model to kindergarten camp, the kindergarten countdown model. So let's talk about the 2013 countdown camps and do a little quick recap. So I don't know if you wanted to highlight anything, Stephanie, from this chart, but this was a really quick chart that we put together. As we've grown, it has been harder to keep track of all of you. Stephanie?
Yeah, I think the only thing I would add is, as you can see, most of the communities have at least one camp, but you can see that there are some communities that have really just become enthusiastic and embrace the camps, like LaPorte, I think had 6 camps, and Arnett had 5. And so I know that's certainly one of the things that we want to talk about in 2014 is, that right balance in the number of camps. But it's really exciting to see this sort of enthusiasm and growth in the camps.
Great. So some of the outcomes in terms of the actual grant expectations between IAUW and IU Health, we had 2 primary goals for the camp. One was to register 20 children per camp in 10 counties for 250 campers. And we actually ended up having 400 campers, so I'm really thrilled that we were able to exceed that goal. And again, we could not have done that without the great leveraging of funding that happened, and primarily in the LaPorte and the Tippecanoe County area, where we had just a massive explosion of camps and campers. And then our second goal is really to increase the Get Ready to Read assessment. Again, as Stephanie mentioned, this is very outcome oriented. It's not just a feel-good program, but we want to measure and make sure that we're making a difference. And we did see that difference, that we had a 21% average increase on the Get Ready to Read scores. And then we have lots of other anecdotal information that we will talk about. I do want to just highlight how we present this. This was in the Kindergarten Countdown final report. So for those of you who are new, the the Get Ready to Read assessment is just a very quick assessment tool that can be administered by a volunteer after a very short training. It assesses pre-literacy skills, and then at the conclusion of the camp, there's a post-test that tries to measure the growth. So you can see how that growth looks by school. You can see the percentage change, and I just want to highlight that we have some sort of outliers where there's a just phenomenal percentage change, and then some that appear actually kind of low. And I'd highlight that in those areas that are lower, it may be because of the way that those camps are operating in those communities. So for example, in Monroe County, the kindergarten countdown model actually was built in to an existing sort of summer school option program through the school system, and because of the way that camp's run, a lot of the other community children who may not have the same academic needs or be as at risk are included in the same pool, but you still see growth. And then lastly, we see the STEP scores. And this is where I wish we had Heather because I am not an education expert. But basically the skills, their initial scores sort of assign them to a step of children who have either emergent skills or have solid skills or above those sort of, not above average, I think there's a different term, but there's a desire to see that children are staying within the same step or increasing their step. And certainly we saw lots of 8 camps moved at least 1 step on average. So these are the kinds of quantitative things that we measure. And then there are lots of qualitative ways that we try to measure the outcomes of this partnership that we have. And some of those that I'll feature here are that we really have used this to increase the awareness of kindergarten readiness in the community, and the fact that we do have lots of children showing up at school who are not ready for kindergarten, who don't have the pre-literacy skills, but they also don't have the social or the behavioral skills, and we see a real growth in that. From IU Health's perspective, Stephanie, you might want to jump in about your desire to see action-based learning and some volunteer and parental engagement. We did see that this year.
Absolutely. One of the things that I have been fascinated with as I've learned more and more about action-based learning, and it shows some very high correlation from some studies that show that kids really seem to learn well by doing things while they're learning. So the idea of, you know, instead of calling them brain breaks, I really like to call them brain boosters, because it really seems to be that when kids are moving, it really fires up all areas of their brain, and it really just helps them absorb that information. And if I remember correctly, there are some studies to show kids that learn through action-based learning oftentimes will have a 50 or 60% greater scores than other kids. And so it's one of the things that we really are interested in exploring that, and are those things that we can incorporate into our camps moving forward. So just as an idea. And then to Lucinda's point, because this was designed initially to be IU Health's signature project, volunteer project for Strengths That Cares, we really want to make sure that in each of our communities we're doing our absolute best to ensure that our team members are getting an opportunity to go out and help in the schools on a daily basis, even if it's for just 2 hours, just exposing them to the impact that this program can have. And so really just want to urge that as these camps are designed, that we do our best to try to incorporate IU Health volunteers into them. And I think, Lucinda, the last point you made, I think there's so many studies out there to show that when parents are engaged, and we want to also make sure that we are getting the right message home to them and how important it is that they read to their kids on a daily basis, even if it's just 15 or 20 minutes a day, but just making sure that we reinforce that through these camps.
Great. And in the final report, we have some comments from parents. We were able to collect lots of wonderful quotes from parents. There were some parent surveys and some teacher surveys and teacher comments. And those comments, while not quantitative evidence, they really show the qualitative evidence of the changes that happen in the students. We've heard wonderful stories from parents and from teachers about how children have grown. These are kids who come in never having maybe eaten at a table, haven't had to stand in line or take directions, or understand some of the basic social and behavioral skills that are needed. And then we've heard the comments from the teachers about how appreciative they are that they already know their children before the August start date of school, and that this has provided them the opportunity to jumpstart that social experience in the culture of kindergarten. So we so appreciate all of your work in that. So in the debrief, we had lots of great successes, and we also had some things that we've missed. We know that both in the IU Health side and in the United Way side, we've already taken some feedback about what were the best and what are the best things about the camp, and what are the areas where we could probably improve. And so I'll turn it over to Stephanie here if you want to highlight any of these.
Absolutely. Thanks so much, Lucinda. So Lucinda already shared this, but I think the fact that we succeeded our goal and we reached over 400 kids in camps is certainly a hit. Certainly want to consider, how can we stretch this even further in 2014 so that we can reach more kids and make this wonderful impact. And can we expand it to other IU Health communities that maybe haven't had a camp the last couple of years. So I want to certainly look for that. We certainly always want to strive to increase the Get Ready to Read scores. And really also, I don't know if everybody's phones, if you're able to contribute or not, but love to hear if you have other hits that you think aren't captured here. Certainly want to hear that from the group. If we had to jump over and talk about where were there areas for improvement, I know that I've heard probably maybe a little bit more collaboration between the partners involved, so between the IU Health representative the Indiana Association of United Way representative and maybe the school, that we're all just making sure that we're talking and trying to figure out the resources together, and even what school to select, for instance. So I know ideally if we want volunteers to get there, ideally we want the camp obviously to serve underserved children, but also to be relatively close to where our volunteers live and work so that they can get there and not have an hour drive, you know, going there and back. So just being kind of cognizant of that, I think, are some things that we can talk about how we can improve that in 2014. And then I know that there are some camps that fully utilize IU Health volunteers, and then there's others that haven't been quite so successful, so how can we help improve that? And I'll just open it up if others have ideas of things that they want to share as hits and misses.
I'm looking down the list to see if we have any. I don't see any questions or comments in the chat box or in the question box. Let's see. Corin. Okay. Sorry, I am not as good with the technology as I should be. So anyone have a question or a comment or an idea of how to improve? If you do, you can type it in the chat box, or you can raise your hand and we can unmute you. All right, I'm not seeing anyone. So maybe we covered it. The communication and collaboration is an easy, it's not always easy, but those are certainly areas that in lots of collaborations, they appear as areas of improvement. We can always improve in there. All right, well, let's move on then. And we'll continue as we talk together as the locals meet in their communities. We can talk about how else to improve for this year. So Stephanie, you had some specific questions about the 2014 enhancements.
Yeah, so Lucinda and I met, and a couple of other representatives, and when we did our debrief, talked and kind of threw out some ideas of, are there things that we could do differently or we might want to consider in 2014? So I really wanted to ask that of the group. And one idea that came out of that conversation is, do we want our physicians, our IU Health physicians, so our pediatricians or our family doctors, referring kids that they think may be at risk into a camp in their community or not? So I want to ask that to the group. Does that make sense, or does that make it too complicated, and do we really want to leave that referral process to the school? So that was one question. So if you have thoughts, if you can type those into the comment or chat box, that would be fantastic. And then the second question, I'll go ahead and ask while hopefully you're typing away, is do we want to offer a back-to-school supply drive? So currently, IU Health does solicit book donations from our team members that participate in Kindergarten Countdown, and so that each child can take home a book each day of camp, which has just been, I think, really well received. I think our team members get excited to be able to bring in books that maybe have been favorites with their children or grandchildren to share with other kids, and wondered if there was more that we could do around that with the generosity and perhaps helping these kids really, when it's time to go back to school, make sure that they have the supplies they need. So I wanted to ask what your thoughts are on those two ideas, and if you have other ideas, if you can type those into the chat box, that would be fantastic, or the question box.
Great. And let me just explain from a technology standpoint. I see that most people have actually dialed in. I can unmute everybody, and let's just see. Oh, I can't unmute everybody. Yes, I can. I'm unmuting everybody. Oh, my gosh. That's not a good idea. For those who are on computers, I've unmuted. Sierra is the only one on the phone. If you are on a computer, oh, I hear lost audio. Hopefully you haven't lost the audio.
I'm still hearing you, Lucinda.
Yay. Okay, so here we do have some comments. So Katie thinks a supply drive would be a great addition. Kathy offers that in Avon, the student selection is tied to their formal kindergarten assessment process. So the positions in the camp are allocated to the schools to fill. So she's not sure that a physician referral would work in that community. However, she says it would be great to have a physician or two participate as volunteers. So I don't know if you have any comments on that.
I do, and Kathy, I agree. I think it would be absolutely wonderful to have physicians volunteer, even just in the camp itself, even if we don't get them involved in providing referrals to the camp. And I know Arnett has had physician engagement before in volunteering for the camp, and it's certainly something I want to push in 2014. In fact, we are rolling out new volunteer software, and I cannot wait for us to get dates for our Sheridan and our West camps so that I can get those in the software right away, because my physicians tell me that to volunteer they really need those dates 6 months out, if not 12 months. And so the sooner we can get the nailed down for the West and the North camp, I plan to get those out on our Volunteer Match software so that we can promote those to physicians right away.
Okay. Our next, we had several folks say that they'd like to see a supply drive. So Peggy up in Stark County would love to see that. Rena, the PTO in White County takes care of all the school supplies for the elementary children. So that maybe wouldn't be a need in White County. Sierra offers that back-to-school drive contest for IU Health entities might be nice, a sort of competition between the entities. My gosh, I have lots of comments here. Great to have more men volunteers. We really need men coming into the schools. So that might be a strategic kind of recruitment effort for you, Stephanie. I don't know what your breakdown is of volunteer participation.
And I think, if I'm not mistaken, right, I think we are heavily, just from our employee base, definitely more female-oriented, but it's certainly something we could strive to try to do some recruitment efforts around getting some men there. We can try that. Yeah,
it's what we all face in social services. United Way meetings can be very similar. Let's see. Kathy offers that our local United Way holds the annual backpack attack for school supplies. So a drive could be considered duplicative, but the hospital served as a collection site for the first time last year, so it might be an opportunity for partnership. Tippecanoe County is interested in the physician referrals, but would like to try to limit to low-income families. So there might be a concern about a physician not referring someone who wouldn't meet the other eligibility criteria. So I don't know what that would look like. Amy also offers that school supplies would be helpful in terms of a school supply drive. And one more comment about physician referrals so that we can go back to that. I would like to see more physician referrals where possible. Sometimes the schools don't know who the students are if the parents don't bring them to the kindergarten roundup. So the physician referral, particularly for the rural counties, might work.
Great. Lucinda, are you able to share who that comment came from or what area, perhaps?
For which one?
The last one that you read?
Oh, I'm sorry, from Peggy up in Stark County.
Okay, great. Thank you.
So physician referrals would be great there. All right. Any other ideas? That's a great discussion. We can move on. All right, so let's talk quickly about the roles for our partners, just so I know that most of you who've done this before know the roles, but for our newbies in this, we'll talk about the IU Health roles and the United Way roles. So Stephanie?
Absolutely. So one of the roles that IU Health provides is certainly providing some investment or funding to help this happen. So the last couple of years, IU Health at the system level has made a $90,000 contribution to help support these camps. In addition, IU Health has also provided about $10,000 in donations so that each kindergarten countdown camper gets a backpack and a t-shirt. And then our goal is to provide about 400 IU Health Strength That Cares volunteers to go and help these kids in the classroom. And then lastly, we've also organized book drives to ensure, again, that each camper gets a book each day of the 4-week camp.
Great. Oops.
So one of the things just at the local role that, again, most of you know, but I know we have a couple of new folks on the line, is certainly one locally from IU Health's perspective, hope that you will provide input on to the location for Kindergarten Countdown. You know, certainly we want to stress that this is for at-risk kids, and a lot of times that means low-income schools. So I want to take a look at that. And we also know for you to be able to get volunteers there, certainly we have a desire for the school to be relatively close to an IU Health hospital if possible. And then also conduct a book drive to help get those 400 books for those 20 campers. So you may need 800 books if you're doing 40 campers if you have 2 camps. And then not lastly, but also to recruit your team members to help volunteer in Kindergarten Countdown, and to still the great idea that came out of Ball Memorial would really encourage you to host a Kindergarten Countdown champion breakfast to try to generate some enthusiasm and buzz for getting volunteers. Perhaps even a steering committee to help you plan this if you need some extra hands and feet to help coordinate this. And then, of course, promoting awareness within IU Health and then also in the community. And I know many of you have done this, which is look for additional ways to provide in-kind support. I know in the past Tipton Hospital provided lunches from the IU Health Tipton Hospital cafeteria. So just looking for those ways that you can help provide additional ways to support the camp.
Great. And from a United Way perspective, we at IUW coordinate the funding. We work with our local, we try to coordinate with each of the local United Ways or funds so that they can make that relationship with their IU Health and the school, because the school is also a key partner in this work. We really want to work with IU Health in selecting the area of the camp, but we understand that sometimes there are other factors like the schools that drive some of that. We use the United Way work to leverage other relationships and partnerships and resources, and there have been some great examples like what Lori Hamer has done in Lawrence County with the Economic Development Corporation there and or Council, what Greater Lafayette United Way has done by investing and just really expanding with so many great partnerships around the state. We've had great partnerships around some of those other options around field trips and around transportation. So it's part of our job to help leverage those relationships. Again, we want to help promote the awareness, actually coordinate the camps. And I know we have some other United Way folks on this call learning about the camps, and we will talk about this as a camp model because we're bringing some other non-IU Health funds to this table that we'll talk about at the end. But part of the grant process through IU Health is that we coordinate the camps, which it means identifying the schools, making whatever kind of agreements with schools or teachers or transportation that's needed, ensuring that meals are provided if that's required, what kind of supplies are needed in that classroom. IUW actually orders the assessments for you because of the way that there's a sort of cost efficiency if we just help arrange the assessment tools and the curriculum if needed. We try to provide that point of contact. It's the local United Way's responsibility to provide that contact with the school to identify the students and to make that referral. We have to provide an insurance rider, and and that contract with the teacher is often run through the local United Way or United Fund. And then if there's any additional fundraising that's needed. So that's kind of what we do, partly through IUW, but often through our members. So let's talk about the timeline for 2014. Stephanie, do you want to take any of this?
Absolutely. So thank you today for helping us kick off Kindergarten Countdown. Hopefully you're finding this useful and helpful. The other thing that will be coming out probably in the next week or two is we are designing some marketing pieces to help promote Kindergarten Countdown. So there'll be a piece that will be out available on the IU Health Pod that will be customizable so that you can go in and update it to reflect your particular camp to help recruit volunteers. And then there'll be a separate piece that can go home to the parents of the campers that's really just kind of letting them know a little bit about what the camp is, the purpose, and really encouraging those parents to read to their students on a daily basis. So anyway, those will be coming very shortly and be available for you in the next couple of weeks. One of the things I would encourage the IU Health folks on is to think about using Sandra Hoover's model of the champion breakfast and going ahead and reserving a room to make that happen in March so that you can get that planned. If you want to think about using physicians, if it makes sense to do physician referral, think about identifying those physicians now and reaching out to them either this month or next month. And then before we know it, it'll be time to conduct our book drive. So right now I've tentatively slated that for March, and of course you're welcome to move that around to whatever timing works well for you, but just want to make sure that's on the radar.
Great. And folks in from the United Way perspective, I know that many of you at the local level are already promoting the Kindergarten Roundup events. Many of those are happening very soon. They seem to move back all the time, earlier and earlier. But then to connect with those schools to identify who's most at risk, who's most at need. And Peggy, we're certainly sensitive to your issue that you raised, that not all parents get engaged that early. And how do we make sure that we don't miss the kids who didn't participate in Roundup events? And then we want to start to think about the budget. And I will digress for just a second here for the United Way side of this work, in that the purpose of this particular webinar is really to talk about the Kindergarten Countdown camp model and specifically to our relationship with IU Health. But we wanted to share with all that through the Lilly Endowment, we did get a little additional resources that we have for a kindergarten readiness project, which may include camps. So we are still designing that model. It's not a lot of money, and our intent is that those funds would be available to local United Ways and funds, our members, and a competitive process in order to either expand beyond the IU Health funds to expand camps locally, or in the communities where IU Health does not have a presence. We've also been asked to allow other types of kindergarten readiness projects, and we are entertaining that concept. What's really important that we've learned through this model is the importance of having consistent metrics so that we can start to compare and use a similar assessment tool, for example, to show that we're really moving the needle not just in a community but in multiple communities similarly. So there is a webinar next Friday morning, the 24th, about the Kindergarten Readiness Project grant opportunity. So I'll just offer that. But I know that many of you have other local funding partners through your community foundations or your economic development councils or other groups. So we encourage you to start nurturing those now to expand this program much beyond. And then over the spring and the summer, we will finalize those camp numbers. We'll get the actual dates. It's really important, as you heard from Stephanie's perspective, we need to have all of that in line and sort of set in stone so that we can have her side really recruit the appropriate number of volunteers and get those book drives to match. So we all need to be working a little bit earlier, and I take some responsibility on this side that we always feel like we're sort of backing into numbers at the last minute, or we have school administration changes where we may not be able to get into a school as quickly as we like or get the commitment. So we will aim for April on those so that we can really start those camps over the summer. Stephanie?
Yeah, I would just echo, you know, the point of the earlier we can get there, the better. And I also will say, I know every year I always have the best of intentions, Lucinda and I talk early, that we're going to really get it done early. But I feel good that we've done our kickoff call in January. I think this is a great way to start that. I have already started looking at the MOU. And we'll have that ready for you fairly soon, Lucinda, because I know that that's always one of the things that we want to have done earlier. So I'm looking at that, and then I think one of the things that always holds us up just slightly is waiting for our final budgets to be approved here at IU Health. But I feel fairly confident that we'll be at the same level as we were last year. So I feel pretty confident we're going to be able to move a little bit earlier than we have in the past.
Fantastic. Well, then you can see on the timeline, I don't think we need to go through all of this about the background checks that need to be completed, finalizing budgets, getting those backpack orders. And I don't know, Stephanie, if you want to speak specifically to the issue of shirts and backpacks. And for those who are new, I'll just highlight that the T-shirts and the backpacks are incredibly popular with the children, and there's a real interest in making sure that if a camp is offered in a school, perhaps in 2 classrooms, but maybe only 1 classroom is funded with IU Health. We had a lot of requests last year of could we have additional shirts so that we could make sure that no child goes without a shirt, or could we have additional backpacks? We also heard from all of you last year that we would love to have some IU Health shirts, the Kindergarten Countdown shirt, in adult sizes and in larger sizes for some of our children who may be obese, because we know that obesity is a real issue. So I don't know, Stephanie, if you want to speak to any of those questions.
Thank you. I really appreciate you bringing that up. I want to say we always want to do our absolute best to serve all of the kids and community members through that. At the same time, I think everybody knows that the healthcare industry is going through a significant change, which has impacted, you know, our ability to have resources, you know, whether it's, you know, some of our team members that have been let go and just cutting back our budget. So we do need to be a bit careful this year about resources. I know last year, the thought is the kid in one class not getting a T-shirt and another kid getting a T-shirt just really kind of disturbed me, and so we went over budget to make sure that happened. So I really want us to be careful as much as we can to stay within our budget. We've allocated $10,000 to do that. So as much as we can to do that. One of the things you know, where it might be a little bit easier to make that delineation would be, you know, I know, for instance, in LaPorte, there were, I'm going to say there were 7 schools or 8 schools, and, you know, I know from LaPorte's standpoint, we only have X number of team members or volunteers that can support probably really realistically only 2 schools. So what we may need to do is, you know, say IU Health supports these 2 schools, and then all the kids in those schools would get the T-shirts provided by IU Health, but we may not be able to provide those T-shirts to the other schools that are non-IU Health funded. And you know, it's just one of those things of limited resources. And if we can figure out a way to, you know, to make sure every kid gets T-shirts, I certainly want to do that. But we are working with limited resources, and I know each year we've gone over budget in this area because I hate the thought of somebody not getting a backpack or a T-shirt.
Great, and I thank you so much. I think we, you know, as funders, because all of our United Ways and United Funds support our funders as well, we completely understand funding limitations and the need to make tough choices sometimes. What I would ask is that you go on ahead and put in your notes that if we could get the camera-ready art so that T-shirts could be printed, especially for adult sizes, or if there's a desire by a local funder to make sure that everybody has that, that might be an option.
Absolutely. Thanks so much. That's a great idea maybe as a solution.
Right, or maybe Chris Pate from LaPorte asked, could we contribute part of that or to use your group price purchasing because you might be able to add, say, 50 shirts at a cheaper rate than we could. So that may be something that we'll want to talk about. We did ask for, and Sierra asked, could we get some student sizing for the T-shirts ahead of time? Oh, that's a good idea in terms of the actual registration. That might be another idea. Thank you.
Great idea.
Great idea. And then we all, in the flurry of summer, which who knows when summer really is, because we have, PEG kicking off a camp right after school ends in June. Their school ends in May, and they get to kick off in June, and then we have some that go all the way through August. So we can duck the camps, and then there's a back-to-school supply drive, possibly.
Right, and with the balanced calendar, I initially put that in August, and then I realized this past year I personally was buying back-to-school supply drive in July. So I moved that to July, so just as an idea if we decide we want to act on that.
Great. And then let's go through some of your other internal resources that you have.
So again, we'll be having some newsletter articles that will be available for, even if the Indiana Association of United Ways want to use some of the verbiage to help promote, kindergarten countdown readiness, but we'll have some flyers and posters and PowerPoint that you guys can take out and share about kindergarten countdown. So again, those will be available in the next few weeks. And then just as a reminder to the IU Health folks on the call, to think about where you can be increasing awareness and recruiting your volunteers. And so if there's an employee forum or a town hall or a manager's meeting, just be thinking about those sorts of opportunities to do that. That would be fantastic. And then I know Lucinda said oftentimes there's some great community partners. Sometimes the churches or faith-based organizations also have been great at providing volunteers. So just think about where we can be promoting the kindergarten countdown.
Right. Wonderful. And same thing to the United Ways in terms of promoting this out in the community. So we have some next steps where some of the work is on Stephanie's plate and my plate in terms of determining, starting to get the initial work together, but we'd like to assign all of you, especially the United Ways, to start those conversations with your schools now. Start the conversations if you have a volunteer center or one of your core partners, if you have a faith-based partner or a community-based partner who might also be willing to help with volunteers if you're really looking at expanding. And again, we have our webinar on the 24th to talk about the Kindergarten Readiness Project and how this might align with that. And then from an IU Health perspective,
just again, if you guys need to reserve space where you normally conduct your book drives, and just be thinking about getting that information out about book drives and all of that good work. I know many of you have done it before, but just as a reminder, and then before we know it, it'll be time to recruit the volunteers. And I know that this also probably gets a bit tricky and maybe a bit overwhelming for some of the IU Health folks because this often falls on the heels of our day of service, which is May 30th. So just want to start talking about it early so that we can try to plan accordingly and make it as least stressful as possible for those recruitment efforts.
Okay. And now we move to questions, and I do have one question already that we didn't cover earlier. We had a question from Amy saying, is there a way that we could get some additional resources or materials about action-based learning? And I know we sent out some links last year, but perhaps we can provide a little bit more, and especially if you're partnering with if you're leveraging other resources. What we learned last year in my introduction to this concept is that there are some really fancy, expensive ways to do action-based learning, and there's very inexpensive ways that we can do that and incorporate that. Same way with the portfolios, to create portfolios for each student and maybe a parent event at some point. So we will try to get all of that information to you as soon as we can. From a content and technical perspective, we now have a handful of people who have done this several years. We have our Kindergarten Countdown Goddess, Heather Gurton from Central Indiana, who's just such a pro and has provided us such great technical assistance and training resources on how to set it up, how to set up your contracts, how to contract with a teacher, what do you do for insurance, how to handle the transportation, all of the camp logistics. And we will probably within the United Way Network have another call specifically with those of you who are doing the camps, as well as those who are doing camps for the first time later this spring, and we'll talk about some of those nitty-gritty details of running the camp. And you all can give us feedback about when you would like to have that. I know if you look at our IUW training schedule, we have lots and lots of things on the calendar over the next couple months. So go forth and do from a United Way perspective, but we will provide you as much training and support as possible. And Amy O'Shea in Greater Lafayette is also willing to help with others. So what other questions do we have? I'm looking through to see if there are other questions that you can type in, or if you'd like to be unmuted. Anyone? I'm not. Okay, we had a question from John. IU Health was a strong advocate for all-day kindergarten through our legislative connections. Is that still a priority? And Stephanie, I don't know if you want to take this or if you want me to take it, as I talk with Tori all the time.
I'd love for you to take that if you don't mind, Lucinda.
Okay, I don't know if it's formally on the agenda, but I do know that Tori Castor, who is your IU Health lobbyist, has been testifying for early education in terms of, for example, last week with the pre-K bill, did testify that. I don't know that we've had what happened with the discussion of mandatory kindergarten. We do have all-day kindergarten now as an option, but it's still not mandatory in Indiana, and that was part of the legislative debate with the pre-K bill of, are we moving too fast by introducing additional pre-K before we even have mandatory kindergarten? So that created another discussion about what is the appropriate age for kindergarten in general. So right now the state of Indiana doesn't require students to attend kindergarten, to attend school. Compulsory education isn't required until age 7. So there is growing interest in moving that age back to 6. I don't know if that answers your question, John, but that was my attempt. Any other questions? I got a thanks, so hopefully that did work. I'm not seeing any other questions. Stephanie, do you have anything else to add?
I don't, other than I would say, certainly feel free to reach out to me if you do have questions that you think of after we hang up today, or if you have ideas on what we could improve, certainly feel free to reach out to myself or Lucinda. Always happy to hear how we can do things better. So I just want to say thanks again for your time to everybody, and also for all of your efforts and great work in the past on Kindergarten Countdown.
Great. Thank you, and I echo that. And both of us will offer that if as you're having your local, let's say the local United Way and the local IU Health representatives get together, with or without other partners in the room. If you would like to have Stephanie or I have me attend via conference call, anything like that, we're happy to do that. So we would encourage you, if you don't know who your other person was on that first slide of the contacts, we encourage that connection to be made pretty soon. And then we will be following up with lots of emails to you as well. I did get one last question about will the slides be sent out. I thought I sent them out earlier, but we can resend those again. Anything else?
No, but thanks to everyone and have a wonderful, safe weekend.
Great. Thank you all.
Thanks, Lucinda.
This concludes this webinar.